Hello everyone. Today, we're diving into the world of a medication called paliperidone, commonly known by its brand name, Invega. As with all our discussions, this is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Paliperidone, known by its brand name Invega, is an atypical antipsychotic medication. It primarily functions by affecting the levels of certain chemicals in the brain, such as dopamine and serotonin, to help manage symptoms of schizophrenia and schizoaffective disorder. The FDA approved Invega in 2006 for the treatment of schizophrenia and in 2009 for the treatment of schizoaffective disorder. It's available in an extended-release tablet form, which allows for a once-daily dosage that helps maintain stable levels of the medication in the body. Invega helps reduce hallucinations, delusions, and thought disorders, and it also works to stabilize mood and prevent the recurrence of psychotic episodes. Warnings: Invega comes with several important warnings. It is not approved for the treatment of dementia-related psychosis in elderly patients due to an increased risk of death. Paliperidone can cause a potentially fatal condition called neuroleptic malignant syndrome, NMS, characterized by high fever, stiff muscles, confusion, sweating, and changes in pulse, heart rate, and blood pressure. Another serious risk is tardive dyskinesia, TD, which involves involuntary, repetitive body movements that may not go away even after stopping the medication. Before starting paliperidone, it's crucial to inform your healthcare provider if you have a history of heart problems, including arrhythmias or long QT syndrome, as the medication can affect heart rhythm. Additionally, those with a history of seizures, low white blood cell count, or diabetes should discuss potential risks with their doctor. Weight gain and high blood sugar can occur, so regular monitoring of weight and blood glucose levels is advised. Before taking this medicine. Before starting paliperidone, several factors need consideration. Inform your healthcare provider if you are allergic to paliperidone or risperidone, another antipsychotic medication, as cross-reactivity can occur. Discuss any kidney or liver problems, as these conditions can affect the drug's metabolism and excretion. If you are pregnant, planning to become pregnant, or breastfeeding, it's essential to discuss potential risks with your healthcare provider. Paliperidone can pass into breast milk and may harm a nursing baby. You should not take paliperidone if you have a known hypersensitivity to the drug or its components. Patients with a history of severe allergic reactions to similar medications should exercise caution. Before starting the medication, inform your doctor if you have had heart problems, low blood pressure, high blood pressure, a stroke, high cholesterol or triglycerides, a history of breast cancer, a low level of potassium or magnesium in your blood, or if you are at risk for dehydration or overheating. Side effects: all medications can have side effects, and paliperidone is no exception. Common side effects include headache, drowsiness, dizziness, restlessness, tremors, and an increased heart rate. Weight gain and metabolic changes, such as increased blood sugar levels, are also possible. It's important to be aware of these potential side effects and consult your doctor if you experience any unusual symptoms. Serious side effects can include signs of NMS, such as high fever, stiff muscles, confusion, sweating, and changes in heart rate or blood pressure. Symptoms of TD, such as involuntary movements of the face, tongue, or limbs, should be reported immediately. Paliperidone can also cause an increase in prolactin levels, leading to symptoms such as breast enlargement, milk production, and menstrual irregularities in women and erectile dysfunction in men. If you experience severe allergic reactions, including rash, itching, swelling, severe dizziness, or trouble breathing, seek medical attention immediately. Interactions: paliperidone might interact with other medications. It's essential to inform your doctor about all medications, supplements, and herbal products you're currently taking to avoid any adverse interactions. Notably, medications that prolong the QT interval, such as certain antibiotics and antiarrhythmics, should be used with caution. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking paliperidone. Regular monitoring and periodic checkups can help ensure the drug's efficacy and safety. The recommended starting dose of Invega for most adults with schizophrenia is 6 mg once daily, taken in the morning, with or without food. Depending on how you respond to the medication and based on your doctor's advice, this dose may be adjusted. For schizoaffective disorder, the recommended starting dose is 6 mg once daily, and adjustments can be made based on individual response and tolerability. Patients with moderate to severe kidney impairment may require lower doses. Avoid. While on paliperidone, it's advisable to stay hydrated and avoid becoming overheated or dehydrated, especially during exercise and hot weather. Avoid drinking alcohol, as it can increase certain side effects of paliperidone, such as drowsiness and dizziness. FAQ. Many wonder about the age restrictions for paliperidone. Currently, its safety and effectiveness in individuals younger than 12 years old are not well established. It's always best to consult with a healthcare provider for any specific queries related to this medication. Closing. That wraps up our overview of paliperidone. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.